My name is Norris. I'm a consultant orthopaedic surgeon and I practice at Kim's Hospital. Knee replacements are essentially used in people that have significant painful arthritis within their knee joints. And that's to say that they have lost a lot of the joint surface, the joint cartilage has been worn away over the years and are left with, unfortunately, significant pain within their knee, limiting their function. Knee replacements are a resurfacing really of the joint surface using metal and plastic components which are cemented in place, and they mimic what a normal knee would look like. When you have a knee replacement, you have a 2 to 3 day stay in hospital. Again at Kim's we have an enhanced recovery program to try and mobilise the knees as quickly as possible. This gives the better result of the patient getting home quicker, but also improving the range of motion and getting them back to normal function. From the point of view of admission, you're admitted on the day of surgery. You undergo the operation, usually under a general anaesthetic or a spinal anaesthetic. We replace the worn out sections of your knee and then get you mobilised quickly. Patients go home usually at 2 to 3 days following it, and you will get some physiotherapy afterwards to try and improve the range of motion. Knee replacements in general tend to be more uncomfortable than hip replacements, and often the recovery is slightly slower. However, the patients that move their knees quicker and get mobilised quicker tend to have better outcomes. The key thing in the recovery of knee replacements is regaining the range of motion within the knee. And certainly for the first 6 weeks, there is quite a lot of swelling and bruising around the knee, and a lot of the treatment is aimed at reducing the swelling and improving the range of motion. We like to get people fully straight and bending over 90 degrees, and most people gain 100–120 degrees range of motion. From the point of view of driving, you normally can get back to driving within 6 to 8 weeks of the surgery, and most people get back to work in that sort of time frame.